Hi, good afternoon, everybody, and we are now officially live. Thank you for being patient while we're just getting the technicalities of a hybrid Go Rural seminar sorted out. We are very happy to have Dr. Mayara Floss here this afternoon. So she has been, there's actually two organizations that's made it possible for Dr. Floss to be here. So the South African Academy of Family Practice had their conference a week ago, and the Rural Doctors Association conference is coming this next week. And so we teamed up, and together we made it possible for Dr. Floss to come out all the way from Brazil to come and visit our conferences. She was a keynote speaker at our Academy Congress, and she's going to be a keynote speaker at the Rudasa Conference on Friday. And what she's been doing in between the two conferences is actually visiting universities all over the country. So she's been to Stellenbosch University, to Wits, to SMU, and she's finally ending up with us. I just want to give a little bit of an introduction. Just grabbing my email, there we go. And there's a very long CV, but I won't do the very long CV because I think Mayara will be covering the odd bit here and there. But she completed her residency in family and community medicine at Grupo Hospital, I hope I pronounced that correctly.
You don't need to pronounce it.
In Porto Alegre, in Brazil. And she works at the moment at a primary healthcare clinic at a community level in Florianópolis, Brazil. It sounds very exotic. So she graduated in medicine at Federal University of Rio Grande in Brazil and did an undergraduate fellowship in Ireland through the Brazilian government program. And there she was working for an organization called Science Without Borders from 2014 to 15. Since then, she's developed a number of projects to raise the awareness of rural health care, including Planetary Health, which she'll tell us a bit more about today. And she's the co-creator of an extraordinary number of global projects, both in promoting rural health, in looking at how we provide better care at primary healthcare level and communities, and how do we inspire healthcare clinicians to come to rural health. So that's why she's here a little bit today. But she's not going to be inspiring you guys to go to rural health. She's going to be inspiring you guys to stay in rural health because you're already there. So we're already in those rural universities, and sort of to look at, is this something you actually want to consider staying in once you've qualified? So thank you very much. She'll tell us more about some of the details of these things as we go through. The way the afternoon is going to work, it's 2 sessions, and there'll be a little break in between as well. Mayara will speak a bit, and we'll have a little bit of discussion time. There'll be a break, and then another talk and a little bit of discussion time. Because we're virtual, I will sort of chair questions and things that come up. I just ask for our virtual listeners to please just keep yourselves on mute. Thank you very much.
Thank you. Thank you, Madeleine, for inviting, and thank you, Lungi, as well, who's representing Rudasa, and thank you for being here and the ones that are watching. It's really good to be talking about, inspiring about rural and change, because I do really want that you feel like why we are here, why have you decided to study health? Have you ever been like thinking, is these questions coming and coming for you? Because I'm always questioning myself, like why I'm doing these things and why I'm here, why I'm doing this journey. So okay. So I just want, before I really start, to remember us that our world is in war, and we need to talk about these inequities, and we cannot ignore this, and that usually our governments in the world that we live now, we're doing bad choices for people. And if you got like this data is really important. It's like we have 67% of people that received at least 1 dose of COVID vaccine, but just 20% of people in low-income countries have received at least 1 dose. So this is a quite serious thing when we're talking about rural, and I will show you why. So we have 8 out 10 women living in below international poverty line. They will live in rural areas. So the areas that have less access to health, the areas that have less access to other facilities or other health treatments, they are in rural. So if you got like this map that would share like where is the poverty line populations, it's usually also the countries that are more rural. So this is just to show you how it's important to be talking about like equity and rural and justice and how we work for change and why we are here. So, and then if you go to the Brazilian data, like in the last 2 years, because of COVID, the maternal mortality rose 77%. This is because of bad choices of governments. We didn't have the lockdown in Brazil. And I must say that ethnicity, comorbidities, gender, it's such an issue. And I came from Brazil, which suffers this issue. These issues that's quite like similar here as well. So a lot of people say, okay, but we need to look at the economy part. But to say that economy is more important is like saying that the ship matters more than the crew. This is what Ailton Krenak said, who is our leadership. So I want to make you think about how we connect each other and how we can build resilience and strength to face all the challenges that we need to live, like climate change. We'll be talking more with you, and all the other like challenges as being maybe rural doctors being isolated or these kind of things. So I will start showing you a movie that I was one of the producers, and I was also working with WHO at that time to talk about recruitment and retention of rural health professionals. And I think it's a quite interesting movie for us to start. And if you want to ask me anything, you just can hold your hands up, or I can go through all the things and we can talk at the end. So let's check.
Why do we need rural health workers? Did you know that almost half of the world population lives in rural areas? This includes populations that live near rivers, in forests, deserts, islands, mountainous regions, and other remote areas.
8 out of 10 people living in extreme poverty live in a rural area. More than half of the people living in these areas are without adequate access to essential health services.
Yet, rural health and access to health services are often neglected in analyses of health status and health system performance. Universal health coverage cannot be achieved without a well-trained, motivated and supported rural health workforce.
Addressing the maldistribution of health workers in countries is key to addressing the pervasive inequity in access to health services in rural areas. So, what can be done?
Within a primary healthcare approach, health workforce policies and strategies play an important role in not only ensuring better health outcomes, but also in driving community engagement, gender equality, and sustainable economic development.
There is a clear need for a whole of society approach to develop, attract, recruit, and retain health workers in rural and remote areas.
We must invest in development and training of multidisciplinary fit-for-purpose rural health teams.
Enrolling students with a rural background in health workers education programs, bringing students in health worker education programs to rural and remote communities, having health education facilities located in rural areas, and aligning their education with rural health needs.
We must protect and support the existing rural health workforce by giving them decent conditions to live and work with access to continuing education, professional development, and attractive career pathways.
It is also important to recognize the contribution of this workforce. To guarantee and ensure healthy lives and promote well-being for all at all ages, we need to have policies to develop, attract, recruit, and retain health workers adapted to the unique realities of rural and remote areas.
The newly updated WHO guideline on health workforce development, attraction, recruitment, and retention in rural and remote areas offers a broad view of what can be done to achieve the global principle behind the 2030 Sustainable Development Agenda and to leave no one behind.
So let's think and act in rural areas
Together.
So that's my invitation to you. This video was produced with Rural 6, which is a network that we'll be talking more about later. So I decided to bring something from Brazil to you, which is my most traditional food, which is rice and beans. And because sometimes we kind of need, when you're talking about rural, and equity and creating a better place for change, we need to go back to the basics. And I think sometimes we're so badly getting back to the basics. So I think in the world as we are now, I feel like at least myself in a roller coaster. Like it's a huge privilege to us to be here today. We survived it. We got vaccines. And we were able to be here now. And it's such a privilege that we need to remember about these things. And talking and reflecting about this is a reminder of why we are here. And I just want to go back to what sustains life in my country. So just to share you about a little bit of our culture. But malnutrition, going to the other side of that, is being a such difficult thing in Brazil. We have got back to the poverty line and a lot of my patients are in hunger. And I just learned that this funny word from here is hunger, like anger and hunger. Hungry, sorry, yes. So I think actually globally, close to 193 million people are acutely food insecure. I'm sure it's a reality for here as well. And I just to talk about it because can you imagine that we are in the first 21st century and we're still struggling with the same things from the 90s or the 80s. We're still struggling with the same things. So it's time to make things different. So I just want to show how we are affected about malnutrition and how many children still being malnourished and that they got short to the age and that they got like too thin or this kind of stuff. So, but then I want to make you think about how we are producing food in the world. So we have like the habitable land in the Earth's surface is 29%. So, and then we have 71 that we can use from our surface in the Earth. And then 50% is being used for agriculture. And then if you got there, we got just like 22% for crops and 82% for plant-based food. So just want to say this graph that's half of the planet is used for agriculture, but only 21% of global agriculture area is used for human food. So this is for us to think, if today we stopped to use petrol and anything related to that, and we say like, oh, then we would solve the global warming and climate change. It's not true, because one of the major drivers is the agriculture use. So this is what we need to think when we are talking about rural. and urban and equity, because actually where is the food produced? It's in rural areas. Well, there is like some things gardening, urban gardening, but the majority of the food is produced in rural areas. So when we are talking about this food thing, which is what connects us all, because I'm sure you ate something today, and I myself as well. So we need to get connected by food. So, but who produces the food is rural. And then malnutrition in all its forms included obesity, dietary risks, and all of this is related to climate change. I will show you. And then we are talking a lot about a pandemic. What is like COVID is a pandemic. But have you ever heard about the syndemic? That's the junction of many pandemics. So we have obesity, malnutrition, and climate change as a syndemic. So this is one thing, as we are the future of healthcare, we need to think about this syndemic, because the problems are quite, they go together. So we need to develop a complex thinking, which is very hard for us, because usually we are following patterns and going like one way there, one way there, or so we need to try to think in complex thinking. So this is from a Lancet study, and then it just shows how natural systems, and then we have our norms, economies, policies, food, transport, urban design, school, hospitals, workplace, families, but then we have climate change, which will determine how we produce food, and then we have undernutrition, obesity, and then this affects how we live. Because like as far as the crops are going like with a lot of pesticides in a very monoculture way, they actually have less protein inside the crops. So this affects also like how we feed ourselves, how we are getting, how we are producing like our life, and how we are producing our food and all these things. So, and if our children got like malnutrition, its risk to get obese is very high. So all of these things are connected. So I just want you to try to connect dots and connect things when thinking about this. So actually, when we are talking about rural, and that's why you are so special to stay in rural, is that 50 to 7% of people living in rural and remote areas do not have adequate access to the essential health services they need. So on one hand, we have like the rural people who cares for the forest, for the land that produces the food, and then they are the ones that have less access to health. Doesn't seem that fair. What do you think? So being rural, staying rural, working rural, it's like a blessing for the world and for the planet, for constructing a better place for everybody, the global community to live. And this is like, just going one step further, we got like the CO2 emission, and then we got like the most countries that are emitting. And then we have the consequences of these emissions, like the rise of malaria, the rise of heat stress, the air pollution consequences. So we are getting the consequences, and the malnutrition and the obesity and all of this, who suffers more? And it usually is also the people that are in the rural areas. If you have a drought or if you have flood, who you lost the production? It's the rural people. Like the city will have other problems, but it's just that we are talking about this. So I have been working, we wrote this article for BMJ, these are the BMJ blog text. We are talking a lot about, when we talk about primary care, to bring together all its principles and attributes with planetary healthcare. Because we need to bring this idea of how we are affected by climate change. We just want to share this with you. And I'm sure you have seen this rainfall or this heavy floods in Durban. Do you? Yeah, I'm sure you remember it. So just to show you something similar that happened in Brazil, it is like a cyclone and rain and floods that happened near where I live. And I was observing like how was the COVID evolution that days. So this one when the cyclone bomb affected that region. And can you see how the COVID cases grew? So that's what happens, like everything is connected. We cannot have just floods and think that they're not having consequences to people in infectious disease, in all the people that will be not compensated, like with hypertension or diabetes or this kind of things. So then people need to fight against a cyclone bomb. They need to construct, they will be like not using masks, they will be like very vulnerable, and then it raises the case of COVID. I'm sure it happens in Durban as well. It happened. So it doesn't have a point in a world that is on fire. This is in California last year, that we wear a mask, wash our hands, have social distance, and stay safe. If it's just everything warming and getting on fire. We have like the library in Cape Town that took fire because it was like fire on the table mountain. I'm sure you remember this as well. So we are living in a world that's very unstable. And this will be the instability. And if you don't change in 10 years, let's say, you're going to just have much more instability. And we will be suffering the consequences of this in our daily practice. So I want you to do an exercise. Can I ask you all to just lay down a little bit and close your eyes? Yeah, very comfortable. Close your eyes. Sure. Okay, so can I just ask you to imagine? Let's do an imagination exercise. Imagine that you are in East London in 2050, but this is a dystopian world. And you are coming to the rural health center from your home where you live. But then, because of air pollution, which is one of the big killers in the world, you cannot come without using oxygen masks and leaving oxygen outside of the house, otherwise you cannot survive. So you are walking with your friend, your best friend, all together when you're going to work. So imagine that as you check the oxygen before you left home, then you realize that actually was some problem there, and you're going to stay without oxygen. And if you're without oxygen, you cannot survive because we're such in a bad world with climate change and all of this. So can I ask you to open your eyes and check under your chair if there's something? Check it. Okay. There's how many people found something? Put your hands up. Can you say what's there? Can you say? Read it.
First, congratulations. You received an oxygen torpedo in the dystopian world of 2050.
So just 3 of you would survive if we don't do things differently. Like, yeah. So who was the survivors? Okay, 3 of you. Yeah. Stacey, can you think about this word? Because this is what we are leading to. And this is why we need to change. I will bring this picture of this woman in Brazil. It's such hard to be those people in the world that we meet as an indigenous community. So some things do not fit well. And I need to say that at my reality, unfortunately, because we're having a lot of tricks on our democracy, we are living in an eco-political world where the choices are not good for people. And we started everybody saying, oh, it's all about corruption. And it leads to a far right-wing leader, which is actually doing actively things to kill people. And to kill the Amazon, that I'm sure that you have heard about this beautiful forest. Just to show you, like with our government encouragement, how this area is being like explored to mining and being cutting down. So isn't that sad in the last few years that we are killing people, that we are mining the Amazon, which is one of the places that produce moisture, like wet, we call it flying rivers, that produces, like, help produce food for Brazil and for the world, and also helps, and it's like this beautiful habitat and rural place that we need to take care of. And we cannot work, and I'm sure this is for South Africa, with this definition, where we just sing things and actually we are surrounded by dead things. That was an artist, an indigenous man called the new souvenir, that produces these arts. So, and because of everything is connected, and I want you to think about this, because of the war in Ukraine, actually, the gold price is rising a lot, so they are cutting more and exploring more in Amazon. So this is how we are all impacted by one side and the other side, and how we need to think together. And just to show you how sad it is, this is like the mine in the river, like how it is affected, and there's like a lot of things that go in the water that was very risky, and it's just horrible. And I think we are in 2022, and I keep saying the obvious. And equity is a still place for nobody of us, a place to reach, but we have so much to walk and too much to construct. And as we are all here in Global South, we have such a challenge, and to decolonize and think differently. And the pressure on indigenous land puts its population in food insecurity. So this is going back to the beans and rice thing. And I'm sure, and then there are also risk of mercury contamination of this. I'm sure you have seen something about the journalist Don Phillips and Bruno Pereira, that was like English journalist that was in the middle of Amazon and disappeared. Not sure if you have seen, but I just want to show you that this is what happened. This is all people that were killed in the country when we are talking about environment. And when we are being activists, this is just like in the last few years. So, and then it's not even the name of all people. So we need to work for democracy. We need to work to construct a better world through politics. And this is our work as well. Because otherwise we're just being flowing as everybody's doing the same thing all the time. And we need to think differently, out of the box. So I always think, if do I have really, and we are talking about global south here, we have a chance to not be an activist, to not be people that were fighting for the right of the people to have access to health. We have these changes because we have this inequity endemic. And I think my everyday is a survival activism. Every day that I'm in the primary care, doing my work, doing my best, I'm a survival activist. And I'm trying to be an equity champion. So I realized that the climate change is the greatest global health threat facing the world in 21st century. There's nothing that you studied about that will be affecting more the health of people. That's not myself saying, it's the Lancet, which is one of the biggest journals in the world. They have this nice website, Lancet Countdown, that I want you to pursue that. But that is also the opportunity to redefine social and environmental determinants of health so we can make the change. And I've been working for this for like some years now, and we have just launched a call to strengthen climate change education for all health professionals. Do you have any class about climate change at university? Do you have like a rural club here where you're discussing this more? Just things for you to think, because you can be part of the change, really. Because if we don't think out of the box, how are we going to make it? So I participated of this team from WHO to write down this letter, which I invite you to check and to ask for your professors about this dance, because this is the major determinant of health of these times. So we need to start to think less ecological and think more ecological. We are having a massive biodiversity loss, massive. We are losing species every day. Every single day, there is a species that is disappearing. And by the way, we are just one of the species on Earth. Just to remind us, we are just a little bit of nature as well. So we need to think differently. And I think we can do the change. We can make it. Otherwise, I wouldn't be all the way from Brazil to here if you don't believe that we have everybody the chance to change. And many of this starts inside of us. Inside of us doing like minimal things, reducing meat consumption, working, recycling, reducing plastic, trying to think how to make things with your patients and this kind of stuff. And then I want to share with you a video of a course that I created about this. I promise you that I'm almost finishing to bother you and just show you.
Family doctor, nurse, nutritionist, community health worker. Actually, dear health professional, I presume that you always want to be the best for your patient. But have you ever thought that maybe you are missing something? When your patient has an acute cardiovascular disease, have you considered the air pollution that he or she is exposed to? Have you checked the temperature of that day? We live on a planet that has changed a lot because of humans. Even COVID is related either to our food production chain or it is worsened when the air pollution levels are higher. Is your patient depressed or feeling hopeless? Mental health can also be related to how we inhabit Earth. talking about climate change is urgent. We cannot miss things when caring for our patients. Planetary Health studies how human health is impacted by global environmental changes. Learn more at the Planetary Health for Primary Care course, available for free and with certification. Do not miss things when taking care of your patients and be a part of taking care of our planet.
We don't have a planet B. We are not going to Mars. I'm sure you know it, but just on the page. So that's the thing, you know, like, and health professionals all around the world have been organizing themselves to this change. It's actually many things happen on Earth, but you need to do it on South as well, south of the world. So we need to provoke you that we need, if we want to have children in the world, that's a big issue for us. And it's not something for future. It's for now. It is for now. It's happening now. We have Durban rain. We have we have heat waves in Europe. So we need to take care of our planet. So you can do the courses. There are 3 options, one in Portuguese. I'm sure that you're not going to do it. But then we have the one that is more focused on community, so anybody can do it. So you have friends that's interested in climate change, or you're making the point, you can invite to take the course on top. And then if you want something more focused on primary care, or more doctor focused, or health focused, go to the second one. So please do it, so we can create this global community, and it will be awesome to have you on board. And just going to my final part, sorry, not first. I have been for years now, since 2015. I just tell you a little bit about my story, which is a funny one. I was in Ireland doing I did part of my studies there. And then the Irish people said, no, you can't do clinical things because you're a medical student from Brazil. And I was in my last year, so it was very boring to take anatomy again, or doing the things from the beginning again. I was so upset. Then I decided I want to do master's modules, but it's not that. I was I got a chance to meet a guy in Italy. And he was an Irish, and actually his father was a rural doctor where I was living. And it was totally by accident. And then he told about his father. And I was like, oh, that's so awesome. I really want to have a chance to see how is primary care in Ireland, that I would be really interested about this. And he said, oh, I'm sure my dad will receive you. I was like the son of the doctor saying getting the internship for myself, the observership. So I discovered rural health by accident. I didn't discover it because I was exposed to. So this is how privileged you are, because you can find this in the beginning or all the way. So and then I got back to Brazil. Then I started talking about rural health at my university, which was pretty rural, where it is. But then the professionals there did not recognize themselves as rural or as a rural space or anything like that. So my professor was saying, what you're talking about? Go back and do clinical stuff or do other things. Or you're good at surgery, do surgery or something, and become a surgeon, something like that. So then it was very, very sad. And when I realized that, I decided to create a space where we could talk about rural, which is called the Rural Family Medicine Cafe, which is this first thing that happens in October 2015. And we have been doing this for over 50 sessions of, I think it's 60 now, sessions of Rural Cafe over the years and meeting people. And it was very funny because it was before COVID, but we were like meeting in a Google Hangouts things. And then we are meeting together, like with people from all around the world to discuss a topic in rural. But I really wanted that we don't have like a verticalized relationship that was very horizontal. So students have the same voice than WHO person, or have the same voice than a professor or someone that's in another time in its career. So it's working well. We have done like many times. So it's our mostly online hybrid. You see, we started the hybrid in 2018. So, and then we, after we started to do it like personal meetings in the big conferences, so we have done some. And we create this hobby that produces videos. I showed some of them to you. We have more than, I think yesterday was, I think it's 200,000 views now with what we have been producing. So I invite you to check our YouTube channel. So I started with the cafes, and then we created something called Rural Seeds, which is this program for, it's not a program, it's a network of people in training, not just doctors, nurses, physios, whatever, who wants to integrate the team is very welcome. And we have a very beautiful community from all around the world. This is the new ambassadors. We have a call that just closed, but you're more than welcome to join the network. And then later on, if you want, you can become an ambassador from South Africa. We don't have anyone from South Africa. That would be awesome as an ambassador. So we are changing things. And I think we have done a lot of things in the world. When I started the Rural Seeds thing, if you put in Google rural family doctor, you would see just white men, old white men. And I was like so sad because where is the woman? Where is the diversity? It's not possible. That's just like white doctors and old doctors into rural areas. So that's one of the things that I have been doing, like trying to make it more fashion. And I just want to show you a video so you can get excited to be an ambassador if you want, or just being part of this awesome network.
Have you ever wanted to connect with people all around the world to construct a fair and accessible healthcare?
In order to have a fair world with access for all, we need to have more health professionals in rural areas.
This idea provided inspiration in 2015 to start the Rural Family Medicine Cafe project. This was followed by Rural Health Success Stories in 2016, and later we became the Rural Seeds Network.
Rural Seeds was launched in 2017. Since then, many projects and presentations on rural health have been done. We are a network composed mainly of students and young doctors with an interest in rural medicine.
Many of us discovered rural medicine by accident, and our desire for rural health has turned us into passionate activists and advocates for rural health. Rural Seeds has now spread all around the world, and we have achieved some amazing milestones, including that we have conducted more than 50 rural family medicine cafes with participants from all continents.
We have produced more than 20 short videos about rural health and intersection areas like women empowerment and planetary health. Our videos have won awards in India, Brazil, and international selections. Our blog, The Rural Health Success Stories, has had over 60 stories shared from health professionals all over the world. We have featured stories from India, Uganda, and Brazil.
Rural Seeds has taken their advocacy to events big and small, from classes in local universities to conferences by the World Health Organization. We have made rural health more accessible.
It has been such a journey from a simple idea in 2015 to a worldwide network today. The journey has sometimes been difficult, but also filled with joy.
We have built real connections through collaboration with our project coordinators and also the Wonka Working Party on Rural Practice with experienced rural doctors and healthcare professionals in general.
In 2021, the first ambassadors of this wonderful network are completing this journey in front of rural cities.
Our aim was to show those interested in rural health that anyone can be an advocate and that big changes often start with small steps and working together.
We are really excited to say that even you can be an ambassador.
You can change how people see rural health and make rural accessible for all people all over the world.
Rural Seeds will provide support and training for new ambassadors to keep the journey going.
If you feel the call to rural, consider becoming a Rural Seeds ambassador.
So what's going on Rural Seeds? If you want to get part of that, so people are doing like with cafes, they belong to the social media because everything's volunteer based and it's been like many years that we are doing that like very intensely. So they're trying to work with them. We are participating on WSU, so we can get like a voice on that and maybe have rural stories and videos. And we have been collaborating with Rural Wonka, and we have organized the story of these rural health professionals from all around the world that are doing amazing things in our story thing. And we have a discussion on rural clinical cases, so a lot of things that are going on, and it's free to join and it's very open. So go to the ruralseeds.net website, you're more than invited. And just bring something different. Vacation, structure, you should be tired of myself. I decided to bring you, I write poetry and short stories as well, because I kind of have this willing to communicate with people in all different ways possible. And I will read you poetry that's not really related with any of what I was talking about. In some ways, I wrote this poem when we have a very difficult case with a patient. I still being like a primary care physician. In Brazil, it's different, but I work like out days of the week in clinics, and it's a little bit different, but it's quite work. There's a lot of work as well. And I try to communicate in between and construct things with people and patients, and being in front of rural cities, trying to train new leaderships and all of this has been such a work and a task. And so I will read this poem, and then I think we can have a break and then have a chat. So I'm playing with the words. I do have free translations in Portuguese, so probably I'll miss something, but I'm playing with patience and patience. So it's called impatient. In this tissue that goes out of your mouth, in the skin of the words, I touch, I draw, I listen with my stomach. I go inside myself, and then I start to swim, to breathe. And sometimes I cannot touch the surface, I cannot reach the surface. I stay under the water and tied to the tissue of the history. I do not give up, but neither I go further. I just try to find breathe, and sometimes I cannot even find air, neither answer. I just listen. So Thank you.
Thank you very much.